Go ahead.
This is a very
When
good
you look
point.
at blood tests from patients who come to you, big package of blood tests, don't look at the numbers. Interpret the test.
Yeah.
That's your job. That's the doctor's job. Otherwise, the laboratory will give you some values. You put the asterisk too low, too high. You got to interpret that in the context of the whole thing. So you judge. As you said, 30 is normal, as they say, vitamin D, but it's low.
Right.
So even how you distribute vitamin D during the month, you know, how you take it, you absorb it or you don't absorb it, and also there are so many vitamin D around pharmacies that, you know,
Exactly.
it's very important, you know, to choose the right one for that person. And if you take it daily, weekly, monthly, it's important.
So Dr. do you agree that the devices that measure the tissue level of those parameters, let's say, are more important than the blood labs? Like, I don't want to just say brand names, but there are devices that measure the tissue level, not the blood level, of vitamins, minerals, heavy metals, and all this stuff. So do you think that those are more accurate and more valuable than the blood labs?
I think what they're trying to what we're trying to deliver here is that there is an optimal level. What that means is not just the level where the hormone is, but the level of all the hormones as they're interacting. Because the importance is how all of these hormones interact with each other. So optimal for that particular individual, because you can have something up here and something down here. Well, this is imbalance right there, and it's within the normal range, but it's still imbalance. And that will create anxiety, that will create lack of sleep, and then we'll go into the glymphatic system that you're talking about, which is extremely important. And I'm so glad you mentioned it. Not too many people mention it. That has to do with cleaning the system, and it's extremely important because what ages us is inflammation and toxicity. So that level, it's how these hormones interact that is the important thing. So it's the optimal for that individual, not just normal range.
If I can answer a question over here, because I face this dilemma in my clinic when the blood tests are normal and the weight loss is not happening, especially for women, and post-pandemic this has happened. If the device is giving you an off reading, the one thing that doctors don't have is the patience to go through, and therefore they want a quick result. So you're saying, if this device is telling me I'm off, are you having that many number of measures over, let's say, 3 or 4 quarters? And is your downward trend to making it normalized there? So you can attack any machine or blood test, or don't look at the normal ranges, but look at the optimal n is equal to 1. But I think what happens is in personalized medicine is you need more exposure, and clients come and dump their emotional garbage at your clinic step, saying that I'm doing this, I'm doing that. But in technicality, when we ask them to report into us with photographs and pictures, they're in Ibiza having 16 bottles of champagne and then come to you next month and say, but your result is not working. So go with devices, but try and get the device that's going bad reading, going downwards over 3 to 6 months, and you will get out of every 100 clients, 5 who will give you nightmares. And they will break your machines. That's a normal.
Also, I just want to add, every time when you use different devices, just be pretty sure they need to be checked after some period. It's one fact, and yes, like my colleague just said, do these checks like semester, like 3 months or 1 to 6 months, not less.
My question is about long-term use of antibiotics, especially long-term use of antibiotics, especially microlids. Now we know that microlids will help us in decreasing inflammation, especially in granulomatous disease like sarcoidosis, like tuberculosis, like chemical weapons that have lung diseases. But now we are hearing about no usage of antibiotics. Is the difference between different antibiotics, or there are limitation of some kind of antibiotics? Because in, like acne, we use for long-term doxycycline that change the microbiota of the skin too. What's your recommendation? Now you show us in your about gut, microbiome, and skin, please.
I will share with you some of my experience. So I don't want to divide the antibiotics because all antibiotics they anyway affect the microbiome. So
That's right.
let's say you from another side. Okay, you asked me about antibiotics, but everything is affecting our microbiome. So our microbiome sometimes is changing every 24 hours, and if the patient needs antibiotics, if the patient is on antibiotics for any reason, we cannot stop the antibiotic, but they need to understand this will affect, in my case, I will say about the skin. The skin will be affected. So when I say we need to avoid using antibiotics when we treat the skin, I mean with them when it's possible. But if you are asking me about for me it's very individual. So when my patient is in my clinic, I can manage with it. But it's depending on the cost for what they use antibiotics and for how long time. And anyway, I know a lot of my colleagues are not agree with me. But every time when someone is using antibiotics, my advice is to support the microbiome. And something else, when I'm saying about to support the microbiome, people think about probiotics, million of bacteria. This is not the most important thing for the optimization of the microbiome. These probiotics or symbiotics or whatever, they need to have a protection to give the possibility to microorganisms to be delivered until the intestine, because our microbiome is in our intestine, and we need to know something very important. The microorganisms, they are very sensible. They are sensible to temperature, and if we are asking about the gastric pH, it can be destroyed. So it's a lot of people what as splitting us like professionals is someone who think the probiotics are good for gut optimization, and other ones they just say, oh, it's nothing, you don't need to take it, because the important thing is to choose the right probiotic, and this one needs to be protected, to be delivered until the intestine. But if they die somewhere around your pH or to gastroduodenal passage, we just take all this capsule all your life and you don't see no results. Sorry, did I answer to your question? So just to repeat, for me it's very important, even my patient is taking antibiotics, and I don't mind what class of antibiotics, because there are a lot of publications and they show the antibiotics are destroying the microbiome. So I need just to advise to support the microbiome. And I have a lot of protocols, but it's very individual.
In dermatology, there are many indications for antibiotics, which we must use. But then remember, if you give an antibiotic, you gotta give a probiotic. It's important. Even gastroenterologists say that. And of course, when you have gut problems and intestinal problems, you give them antibiotics many times, once a month, but then we gotta give them the probiotics. Changing and selecting them, they're not all the same. That's why now we can investigate and exercise time, and they don't live anywhere in the gut. They live somewhere in the gut, according to the pHs, many other things. But it's important the selectivity of the probiotic use, and also the gut resistance to the acid. Otherwise, if they're not activated, it's useless.
I think we need to go back to going backwards. First of all, if you look at a disease state, give me a disease state. Let's say it's anything, multiple sclerosis, diabetes, lupus, scleroderma. These are all autoimmune diseases. Go backwards. Why did you get lupus? Why do you have Hashimoto's thyroiditis? The reason you have that is because you have a gut dysfunction.
Imbalance.
There's an imbalance. The body's starting to attack itself. Treating with antibiotics is like saying, oh my God, there's a fire over there, let's put it out with gasoline. That doesn't make any sense. So, but on the other hand, if somebody comes in, they have a fever of 103, they're coughing, they have an infiltrator on their chest x-ray, and their white blood cell count is 15 with a shift to the left, well, yeah, I'm going to give them an antibiotic. But I'm also and by the way, I still go to the hospital. I still treat patients. I still make rounds with residents and medical students. So in the hospital, the nurses know if you start Dr. De Silva's patient on an antibiotic, it's immediate, they get a probiotic. On admission to intensive care in our hospital, you get CoQ10, you get a probiotic, you get a multivitamin, you get a B complex.
Wow.
Yes.
Okay, on our program. So this is what we're missing. And don't interrupt the patient if they're sleeping. Leave them alone. Because again, what I talked about, the limbic system is not going to function if you don't sleep.
Exactly.
So the patient's sleeping and you need to check their blood pressure. Well, you can see on the monitor, the heart rate's 80, they're in sinus rhythm and they're sleeping. Leave them alone. So we have to start coming back, folks, to common sense. I've been doing this for almost 40 years. And what we've lost in medicine is common sense. We need to get back to that.
Yeah.
Gracias.
I just want to add that the problem with illness is unless you go back to the root or to the imbalance, it's going to reoccur. So then you're going to have antibiotics for the rest of your life. The whole point is go back and understand what's the imbalance about and treat the immunity and the imbalance, and then health will take place.
So the good news over here is that there's a lot of funding happening in this sphere of the probiotics, microbiome, and genetic testing. So recently there's in India, which has the largest tuberculosis population, they would randomly give antibiotics to the patient and wait for 2-3 months and then come back again and see that that antibiotic didn't work on the patient. So now what they're doing is in 36 hours, they're screening for every bacteria, protozoa, fungal, yeast in the human system with rapid DNA assay. So the doctors are able to, in a test model, able to get what is the causative agent and then predict the model of what antibiotic at what dose should be given. So this is going to start extending into a lot of diseases that Dr. De Silva said,
Right.
maybe in the next 3 to 4 years itself. So what would happen is testing the patient, not at the poop analysis, at the blood level, at the poop level, at the saliva level, they would go through all of this. So recently my son, we suspected dengue, we suspected something else. I went to this lab, and within 32 hours we got a report that he had nothing of a bacterial infection, of a protozoal, dengue, chikungunya, nothing. And then the doctor just looked at it and says, it is a virus. We even screened for COVID. So that is where I think the world is going to get to. Do we prescribe an antibiotic for longevity or do we prescribe an antibiotic for tuberculosis? Diagnosis is going to get so real time that you'll come to know what it is. My gut microbiome test has given me 7 antibiotics that I'm resistant to. I haven't taken an antibiotic in a decade. So I looked at the Israeli scientist and says, oh, Mr. Fernando, you must be eating chicken. The chickens are being injected with antibiotics that's coming into our system. So sometimes antibiotic therapy, I don't know.
Let me say, if you have a leaky gut syndrome and you have a dysbiosis, obviously,
Exactly.
if the child goes to the bathroom once a week for constipation, 10 times a day, remember, and you interrupt the sleep because he doesn't sleep well, he has belly ache and so on, bloating. What happens? You don't produce serotonin, you don't produce melatonin. If you open the light and go to the bathroom during the night, you block production of melatonin. So we have a lack of that. And obviously when you wake up in the morning, if you wake up in the morning, you're sleepy, or you're not concentrated, you're not well acquainted with your surroundings, and you're not concentrated. Children are hyperactive. They have, again, ritually, the stereotypia and so on, and all these problems. You can see it You eat something wrong and the child becomes, either he sleeps on the table in school or he becomes hyperactive. He disturbs the classroom. And then a couple of minutes, 1 hour, everything is gone. What has changed?
Yeah, and
Nutrition,
then they go on Ritalin and they get more medication and then more imbalance.
Okay, we must go on.
I am Dr. Shekhar, representing Newburgh Diagnostics Lab Medicine Director. I would like to say some more points regarding to the lab test and interpretation. Actually, there is a question from ma'am. Actually, we are taking a lot of supplements in the form of like vitamin C and biotin, all those things. As per the latest updates, there are a lot of these supplements have too much interferences with laboratory tests. For example, vitamin C, it will have too much interference with even cholesterol levels. It may be sometimes it will go false positive and false negative side. So always when your patient is coming to you and you are ordering the blood test, always you have to instruct the patient to avoid at least 48 hours without any supplements. Like biotin, example, biotin is one of the common supplements now prescription is happening. And these biotin have too much interferences with hormonal test. Even your thyroid and other hormone, LHFSH, prolactins, have a positive, false positive, false negative reports is possible to get something. Always I advise the people before prescribing the test. I also advise the patient to, in order to avoid those supplements, if they want to get results appropriate. Thank you.
Thank you, Doctor. This is a big contribution from you, and I hope everyone, it's a take-home message for everyone here. Thank you. Anybody else? Please.
It's me now. Thank you. Actually, you said, my name is Landenberger from Germany, Munich. You said that the autoimmune disease is caused by immune system which is getting nuts.
Yes.
I don't think so. I think in an autoimmune system disease, the immune system is doing exactly what it has to do. It's fighting the cause. But in autoimmune disease, our new infection is heavy metals. And the immune system within our expression is not able to get rid of the metals, so therefore it's reinfecting all the time. So I think chelation and getting rid of the cause is more important.
I agree with you, but I disagree with you. When you look at heavy metal toxicities, as we know today, there's no question that heavy metals are producing diseases that we've never heard of. Not only heavy metals, but forever plastics. The environmental epigenetic factors that are damaging on a cellular level and also the microbiome level. Again, that is just one of the factors. One of the factors are heavy metals. The other factor is other environmental things. The other thing is, what are you eating? What's your diet like? What's your microbiome like? What are your hormones like? How much are you exercising? How much are you sleeping? My message here is there isn't just one thing. Yes, heavy metals, no question. There's xenoestrogens. There's xenoestrogens, chlorine, fluoride, bromide. These mimic what estrogen is doing. It will displace estrogen and it will bind selectively and produce quote-unquote disease. So that's part of the problem. But this is where I think testing and N-of-1 testing comes in, looking at all of the factors and trying to fix chelation. I agree with you. There was a doctor who was a vascular surgeon when I was doing my residency 45 years ago that did chelation. Everybody thought he was crazy. What are you chelating? But you know what? Chelation, when you go back, and the science, NIH did a study, that chelation works. It takes the junk out. But it's just one thing. You have to find the source.
I agree with both of you in some sense, because it's a total body load effect. Of course, dysbiosis is one of the causes, but we also have other causes. It could be any type of stress. As Anselin was saying, the total body load of stress. We react to stress. which are the stressors. These autoimmune diseases we're talking about before, they come up like from nothing at the point of our life, means that the body is subject to many, many stressors, which at that point you cannot cope with, and that's where it comes up. It is about, I mean, you have reticulitis, you have named them all, but I think it's a total body load effect. And maybe you lost your mother, your wife, or your son, or someone, and that comes up after that big, big stress. And they accumulate. And chelation works properly. I do it myself in Italy, no problem. Not in children, but I do it in adults. But all is the matter of the load that we put in. What's the xenobiotics, where you live in, the environment. I'm an allergist, so I treat allergies. And allergy is important. I need to have the medical history of the person before I treat them with the desensitization. Now, everybody does specific immunotherapy. I don't think it's so valid. I've done it for 20 years, but I switched to a desensitization, which is an immunomodulator, which is desensitized for almost any environmental airborne allergen or food. But you cannot do that for chemicals or in England they were doing it, not us. But metals and so on, you take away from different sources, not with desensitization. Even nickel, they try to do desensitization for nickel, never happened. It's not allergy, it's an accumulation of metals. So you try to eliminate it from your body, and you measure in the urine. You do the urine test and see how much nickel is in the urine. Tomorrow morning, after you do something to eliminate it, you have 10 times the amount. Means that you're doing something good, and it's not dangerous.
Okay, thank you so much, doctors. My name is Dr. Paula Nelson. I live here in Abu Dhabi. I'm a dermatologist there. I wanted to ask 2 questions. Number 1 is there's an emergence on social media and in literature about peptides. If anyone of you can explain the peptides, is it good for the gut? Is it good for healing? Like there's BPC 157, TB500, and also KPB, if you know about that. And then the second question for all the doctors to answer is, right now, based on what we're seeing, the safest diet is air and water, right? But we can't. What diet would you recommend for someone that has a lot of inflammation? That's the simplest, that's the easiest, that's the most cost effective, you know, without your particular biases. When you look at all the doctors, all the diets in your, that you have learned about and studied. Thank you so much.
Well, first of all, air and water depends on where you live. Okay, so I would not definitely go with the water diet because there's so much garbage in the water you can't even imagine, let alone, you know, parasites, et cetera, et cetera. Air depends on where you live. Let's just start there. As far as peptides go, I love peptides. I take BPC 157 every day. I take it with KPV, I take it with PEA. And especially when I travel. When I travel, my microbiome from what I have in New York and New Jersey is very different from what I'm eating here. I mean, I've had hummus at every meal. That's not what I eat at home. So my microbiome now is going to completely change, and it's going to change for the next 3 months to re-establish. And then in a month, in 2 weeks from now, I'll be in the Dominican Republic. It's completely different food. So that's going to change. As far as peptides go, there's no question. There's no question that BPC 157 should be on everybody's list when it comes to peptide therapy. And if you're going to use BPC, my impression is it needs to be oral, right? Because you're going to get, with KPV, with PEA, you're going to get the anti-inflammatory component with BPC 157. You're going to get a systemic anti-inflammatory effect. Now, there's other things you can combine that with, because I use BPC in virtually every single one of my hormone patients. So a menopausal woman, you've got inflammation like you have no idea. An andropausal male, you've got inflammation like crazy. Get on BPC, get on the peptides, again, it depends on where you are, legal, etc. But I love peptides. I think we should all be doing it.
I have a slightly different point of view. I agree with you 100%, but you need to understand what peptides are. They're part of a protein. And remember, proteins are the brains of the cell, and without proteins, the cell cannot function. It's like brain dead. The problem becomes when you look at molecular biology and how these peptides are combined in each person, in each individual, to create what proteins. And that is a thing a lot more complicated because we cannot see it. It's far beyond our understanding. It's far beyond of what we can observe under the microscope. So it's a sort of a hit and miss if you think about it. Yes, it might be great, and if your patients are doing really well with it, go for it. But you have to be careful and observe because we don't really know all the details that are involved in this molecular biological combination of peptides that make proteins. So always observe the results, and I think that's what
I agree.
Yeah.
I agree. I totally agree. I think we've also lost the art of the physical exam and the diagnosis. How many of you really do a physical in here? I don't care if you're coming in for a skin check. Check a blood pressure. I'm an internist, right? I'm trained in internal medicine. So I can't see a patient without checking their blood pressure. It just seems like I'm committing a sin and I have to go to confession. So for me, I think we have to get back to talk to the patient. Don't text them.
Exactly.
It's like my sons do. They don't know how to talk. So learn to talk, learn to communicate, and if you can't figure it out, ask the patient, what do you think's wrong with you?
Yes.
You know what?
What do you feel?
They'll tell you.
The patients give you the answer.
They'll give you the answer.
Help you how to help them.
But you have to talk to them.
Because they feel it.
Right. It's the vagus nerve.
Dr. De Silva, on the BPC 157, since you take it, I've also taken it. Do you test for any parameters on liver and kidney profile just to know that you're not overdoing it?
Absolutely.
So how often do you test?
Absolutely.
Every 3 to 4 months.
Got it.
Absolutely. That's the other mistake that people do is that they, telemedicine, for me, I don't do it. If somebody leaves the country, if somebody goes to another state and they need to do 1 visit, 2 visits during the winter, and they're in Florida, okay. But that's not my routine. Because I need to see you, I need to look at you, I need to feel your energy, I need to feel you around me. And don't tell me you can't do blood work because I'm not going to give you what you need. I need the blood work.
Feel your energy is a very, very good point, actually.
Yeah.
Feel your energy.
Hi, I'm Dr. Amira, a dermatologist from UAE. I want to ask about the NAD therapy and the impact it has on our health, because there are concerns that if you are predisposed to cancer, it might provoke it. I also want to compare it with CoQ10 and whether it's the IV route is better than the oral route or.
Anybody? I'm happy to answer it. I don't want to hog the microphone.
I will be very quick because I know doctor wants to talk more. If you ask about NID, oral or IV, here it's also a point. And I'll talk again about my microbiome, my lovely one. When you take something per oral, you need to be sure the microbiome is balanced, because there are a lot of vitamins. If the microbiome is not good, they just pass like transitory in our intestine and they go, it's like a spend of money to don't go too deep. About NAD, anyway, the microbiome is very important even for IV, because the microbiome is lowering the inflammation. And if the inflammation is low, the NAD the patients use by IV, it's used less, so they can have more NAD in their body, is what I want to say. And the results come quicker. And
No, you're absolutely right.
Yeah.
Answer your question. Coenzyme Q10 is a cellular energy nutrient. aging is mitochondrial dysfunction.